So I'm really excited to talk to you guys about shin splints, especially since the pandemic. Majority of runners, especially a lot of new runners, started developing shin splints, really didn't understand what was going on or how to really recover correctly from it. So in the past, I've actually done a workshop myself that's consisted it's been done over a period of 7 days, where we really look at eliminating shin splints for good. So today I'm going to bring you in on a really condensed version of that. The whole idea here with the partnership with Arc Running is to really help you guys exceed and get you to where you want to be with those goals and really eliminate any type of injury that you may have. For those of you who don't know me, my name is Dr. Heather. I am a sports chiropractor. I've been doing this for 22 years. As you can see, I'm a fellow graduate of Palmer West out in California, out in the Bay Area. My background is in sports medicine, athletic training. So what essentially I've done throughout the 22 years is I found that my patients really did get better when we applied corrective exercise and rehabilitation techniques into their treatment protocols. And we really started looking at all their movement patterns and really understanding the kinesiology behind it, because then they were able to get better in a very quick time frame and get back to the activity that they loved most. So that's what I pride myself on. And I love the fact that I've had such a huge success rate. So like I said, today we're going to really talk about shin splints. But before we really even go into shin splints, we have to understand anatomy and physiology, because the more we understand about anatomy and physiology, the better we're going to kind of uncover exactly how to recover from shin splints. The first thing we want to really talk about, guys, is anatomy. And we do want to address the lower leg. And so here's a real simple basic anatomy illustration on the screen for you guys. The one that we're going to really be talking about is your tibialis anterior muscle, okay? This is primarily the shin muscle. And for a lot of us, when we're dealing with shin splints, this muscle is actually not developed. What happens is it just becomes really strained and tasked and puts a lot of pain and discomfort along that shin bone, allowing for that pain to set in, and then for us to feel like we're limping and we're really not being able to kind of go the distance that we want. So for the most part, we are going to pay attention to our tibialis anterior muscle. The other thing is, on the flip side, we also want to pay attention a little bit to our calf muscle. This is the gastrocnemius muscle, and that's going to be on the back side, because it does play another role in shin splints. Because a majority of us who do suffer with shin splints, a lot of the times we don't have this tibialis anterior muscle developed correctly. A lot of times we are a little bit more, stronger in our gastroc muscle. And this is where you might be saying, yeah, I was told to kind of do like calf raises and things like that at the gym to recover from shin splints. That's part of the equation, which we'll get to, but I want to really address the anatomy first. So stay with me. Okay, so like I said, you can see all the muscles that we're going to be dealing with on both the front and the back leg. What we want to really understand first is the tibialis anterior muscle, okay? So now the tibialis anterior muscle does come off the shin bone. You see that we have two bones here. We have our fibula, we have our tibia, it's anterior to our body and comes down towards the big toe. And again, like I said, this muscle a lot of the times is not developed correctly. It's underdeveloped in a lot of runners, especially a lot of like our newer runners. Now, the main focus here with the tibialis anterior is understanding that it actually allows for the toes to be flexed towards our head. That's known as dorsiflexion. Now, for a lot of us, there could be the possibility of having a posterior shin splint. And I want to just address that a little bit here. So there are two shin muscles. You have the tibialis anterior, you have the tibialis posterior. Not all the time is the posterior muscle the one that really is creating the problem, but I want to just address it so you guys have an understanding that it is important to distinguish when we have shin pain, where is it really coming from? Because if you're starting to point a little bit more towards the back side of the leg, meaning like feeling like it might be the calf muscle that's getting strained, that's why I showed you what the back muscles look like. We want to really then see, is it the posterior, the tibialis posterior muscle, which would affect the foot when the foot is striking the ground, in terms of if you are starting to try to run on more of the ball of the foot and allow for more plantar flexion of the foot and ankle. That's going to be really step one, is understanding which one of these muscles is actually being affected. Then the next part of the equation is going to involve movement. I'm very big on understanding flexibility and mobility before doing strength training, because if you really want to succeed in eliminating any type of pain, discomfort that you're having when it's related to running, you really have to address first, where's it coming from? Flexibility, mobility. Then we go into the strength, because if you start with the strength first, you might create a compensating pattern, which is then going to lead to a different injury. So understand first, let's figure out which one it is. Second, let's understand the movement of the leg. So right here, these are just classic PT illustrations of understanding which muscle is it. Dorsiflexion, pulling the toes towards you, what muscles are involved. And again, if we're pushing the toes away from us, which muscles are involved. And again, this is very important because, again, we need good ankle mobility when we run, because there is a little bit of pronation, there is a little bit of dorsiflexion, plantar flexion. All these things play into what happens when that foot is starting to, strike the ground as we're running. Now, again, I mentioned, a little bit of the pronation, supination. Essentially, that's, looking at inversion, eversion of the ankles. These are where these muscles really do play a role in ankle mobility. And again, these are going to come into play when we look at, how do we go about strengthening things correctly? Now, again, I address why. If you're brand new to running and you are just starting to run and automatically are getting shin splints, you've never had shin splints in your life, chances are doing a classic PT remedy is going to resolve your problem. But if you're somebody who is a frequent runner and you know that you just automatically always get shin splints, and you've tried the insoles, the orthotics, you've changed your shoes, you're trying compression sleeves, you're doing all those things, then we need to really discover where the pain is coming from, because chances are it's further up our kinematic chain. The reason why we mostly get shin splints is the overuse component. You need to understand that shin splints is an overuse injury. And if we don't address it correctly from the get-go, guess what can happen? One, you can get a secondary injury, or you can also start to create a bone stress injury, which is also known as a stress fracture, because you're overtaxing that muscle so much, it's going to stress and put pressure on the bone, creating a fracture, which is going to sideline you even further. And a lot of times when we are starting to train for half marathons, full marathons, ultra runs, and stuff like that, shin splints can be one of those things that does set in, because we are increasing our mileage. And maybe we're also not paying attention to our training schedule. This is a lot of times where people always say, oh, I don't need a coach, or I don't need a training program. I'm just going to go out and do things. There's a reason why there are running coaches. There's reasons why there are solid running programs out there, because it's to help keep you from getting these injuries that are going to set in, and make sure that you have a good positive outcome when you hit this milestone. So remember, we first want to kind of essentially understand our anatomy. We need to distinguish, is it anterior, is it posterior? And then we also need to understand why we might be getting the shin splint. Did we really start overtraining too quickly? Or is this more of a chronic issue that is developing because we have another issue somewhere else that we just didn't pay attention to? What are some of the most common causes to shin splints? Okay, so we just stated it. Increase intensity and duration of the exercise. It's essentially saying, you notice that you just are kind of that running out of the gate. You're just tackling it too fast, too quickly, and we're not putting enough prep work into it. What surface are you running on? Are you running on treadmill? Are you running on road? Are you running on trail? A mixture? This is going to be very important here, because certain surfaces like a sidewalk are going to provide that poor shock absorption, but also too, that could also be possibly the shoe that you're wearing as well. Now, the other thing is too, you need to determine if you're somebody who overpronates or oversupinates. So, because again, even though when we run, we want some pronation, some supination, and things like that on how that foot's going to, eventually move, we want to distinguish, is this a factor that's affecting the shin splint? The other thing is looking excessive stress on your legs. Are we putting too much weight, too much pressure on the legs? Looking at how we are actually running. Then we want to also address our sneakers as well. And then the flexibility, mobility component. And another two things could be, are we flat-footed? And do we have any other muscle imbalances? That's going to be some of the things that we want to start to address when we're looking at shin splints. These are very important things. The thing to really understand here is if you're somebody who's suffering with chronic shin splints, we want to really start addressing the kinematic chain. Kinematic chain essentially is looking at what's happening, whether it's from where the foot strikes the ground, going up towards the knee, towards the hip, towards the pelvis, towards the low back, could also all the way be going all the way up towards the shoulder blades as well, into the upper back, neck region, or vice versa. It could be the same way going down. So I'm going to use the example as if you're somebody with chronic shin splints. You just don't understand what's going on. You try all the regular PT type of stuff, but it's still just lingering. It's still happening. Well, this is one of those things where you really want to start looking at a gait analysis or a functional movement screening. And these are two things that I do in office and also virtually. And I know my friends over here at Arc Running, this is something they do as well, because when we start seeing what's actually happening as you're running, so when we understand how we run, then what we can do is we can start taking a look at what needs to change for you in order to eliminate that shin pain. You also might really have some tight hip flexors. You might have a tight QL, your quadratus lumborum. You might have some other things going on. You might have rotational patterns. You might have not enough retraction in your shoulder blades. Your lats may not be engaging when you're running. So when we start understanding through a gait analysis that kinematic pattern, we can start seeing what's going on as that leg is moving through, what's happening with your torso, all these factors, we can start to say, okay, yes, if we address X, Y, and Z, we can make the shin pain go away. We're starting to kind of really say, if it's chronic, okay, stop, go get a gait analysis or functional movement screening done. Let's assess the body and really figure out what is happening. Because here's the thing, if we start actually doing some massage work, one using a massage ball, chances are to our QL, our psoas and our iliopsoas, which are our hip flexor muscles. Then we look at using a foam roller to our low back, our piriformis, our TFL, which is our tensor fascia lata, and our IT band as well. And then going down and using the foam roller on our shins and our calves. Just doing that for a period of 7 days will automatically start making you run a little differently. And guess what? Your shin splints won't really be affected, but that's only one component. So if we start addressing those muscle imbalances and we start really looking at the flexibility, mobility component based upon what was going on in that gait analysis, then from there, we can start seeing this pain start to just diminish itself. Now, here's the other thing. Do you guys know that running is a single leg sport? So a lot of times we're very dominant on one side versus the other. So if you think about it, your shin splint never really occurs on both legs. It's usually prevalent on one side. Now, chances are you could also have another issue on the opposite side where you're offsetting and creating that shin splint thanks to that other issue because you're just like, oh, I'll just keep running through it. I'll just keep kind of going about my life and I'll just keep doing what I normally do. So remember something. If we start with the flexibility, mobility based upon our gait analysis, our functional movement screening, and then from there, we start addressing the fact that it's a single leg sport and we focus on activities designed around executing and engaging quad, glute, hamstring, calf, practicing balance work. These are all the things that are going to ensure that your shin splint never comes back ever again. How many of you guys are actually doing single leg activities? Are you doing any foam rolling, soft tissue work, stretching? Are you adding in any yoga, anything like that to your training programs? Or are you just going out running? Again, like I said, I'm condensing the material just a little bit. So if you guys are interested in really learning what would be those foam rolling techniques, some great single leg exercises that you can do to really help, relieve shin splints, I'm going to also be giving access to my mini shin splint course. It's free to you guys. Use it. It's a great resource. There are a few other bonus lectures in there from other PTs and running coaches as well. So with that being said, I don't think enough of us use a gait analysis. I think you might have gone to that running store. Maybe they had you jump on a treadmill. Well, this is where we really, like I said to you guys, you want to understand what's going on with movement. Because if we see that there is any type of dysfunction in your posture, how you're walking, how you're running, it is going to lead us to the answer of, where is this issue coming from? How do we resolve it for you? And then also too, again, to also make sure you're in the proper sneaker that you need for running. Just because I run in Adidas doesn't mean that Eric or Josh is going to run in Adidas. They're going to run in the shoe that's designed for their running style, their arch, their pronation, their supination, all those things, how they're stepping. So this is why I really encourage the gait analysis. I do it via video. I know my friends over at ARC, they do it as well. So this is why it's so important to really get that gait analysis done, and I highly encourage it. Now, sneakers is always the question I see, and I see it all over social media all the time. Everybody is always jumping right into the sneaker. A lot of times it's not going to be the sneaker that's going to make or break the shin splint. First, again, if once you address those muscle imbalances and we start really seeing how those muscle imbalances are going to then make slight changes to that gait, then we can go and get that proper footwear. These are the 4 factors right here. When we get the sneaker, okay, we need to know, are we a pronator, a supinator? Do we have flat feet or a high arch? When you go to any running store, okay, and I'm not talking about buying them on Amazon. I'm not talking about going to a Dick's Sporting Goods store, your local running store. Now, I'm not encouraging you or saying that you have to go buy a $200 pair of sneakers, but most running stores, they will have people who really understand running sneakers, and they will use these 4 things to really help figure out what is the best running shoe for you. Once you know what that running shoe is for you, then sure, if you want to save a few bucks by getting it somewhere else or something like that, totally fine. But get the right shoe for you, the proper footwear. And a lot of times too, once we've actually addressed all these muscle imbalances and things like that, there's probably very little chance that you really do need that insole or insert or orthotic. A lot of times we look at utilizing insoles and custom orthotics when we're really about that 80-85% better, and we haven't really pushed through to that next step. That usually is an indicator that we need a little extra help, and that's where we want to add a little bit more shock absorption, for our running. That means we really are that heel striker. We need, to really absorb that shock a little bit more. And again, like I said, depending on the surface that you're running on, if it's definitely road or treadmill, you may need that orthotic there. Here's the bottom line. Utilize us. We are here to serve you, okay? We are the professionals that really do understand injury prevention. So utilize us. We want to be able to continue to serve and help you guys and really succeed with your goals when it comes to running. So again, ask us, ask the professional for some help, get properly fitted for those shoes, and have the gait analysis done. Just doing these 3 things are going to make your life so much better. You're going to have such success when it comes to essentially running, to hitting those goals that you have set forward. So seeing bumps along the shin usually is not really related to shin splints, because that could be a couple of different things. One, are the bumps soft or hard, would be what I would want to know. And also too, I would want to know your age as well. Because if you are somebody who also has some varicose veins and things like that going on, the bumps could be related to varicose veins. Or if they are hard, they could also be just little osteophytes. So you could have actually started to just develop little calcifications. I know I actually, because I'm almost 47, right where my tibial tuberosity is, I now have a little bit more calcification, just thanks to a little bit of running on hard surfaces, do that wear and tear. So I developed a little bit more of an osteophyte. But I would want to start using a little bit of some soft tissue work, possibly also to maybe go to an actual PT where they could actually do maybe a little bit of ultrasound as well, just to see if you can't try to break down some of that so it doesn't develop further for you. But it might just be a coincidence with the shin splint. So a lot of times I would start actually addressing a little bit more with the soleus and the calf, almost leading a little bit more towards like an Achilles tendonitis. But at the same token, I might actually start addressing the whole lower leg just as a preventative side, saying, okay, let's address the shin, let's address, the calf, the Achilles, working a little bit more on balance work. So we're getting a little bit more increased range of motion, and also to the perineals, because sometimes the perineals do get a little bit more overtasked and then puts a little bit more of a shift and an imbalance on the other muscles, and the other muscles could be getting a little bit more overtasked when running.
Just a kind of a case study for the group that might spawn some thoughts. Someone was training for Boston that had shin splints 6 weeks prior to the race. Now, all runners hate to stop running. But our game plan with him, going to Heather's point, was he was going too hard, too soon, too fast situation. Now, there could have been biomechanical things, muscle imbalances, stuff like that. But we shut him down for 2 weeks. I was like, you know what, just chill out. We can bike and do a strengthening program. And long story short, he was able to run Boston without pain, and in fact got a PR. So I tell a lot of my clients that pain is speaking to you about a tissue is being overly stressed, either tension, compression, shearing forces, and you have to understand that. In regards to training, usually training errors happen about 3 to 4 weeks prior to injury, meaning you start to increase in volume or intensity, and you may not feel the pain until a month later because it's finally catching up to you.
Honestly, yes. I mean, this is where I kind of addressed initially in the beginning, there are running coaches, there are training plans. They're written for a specific reason, because if you do start overtraining or going too fast, too hard, you could start developing the shin splints. But second to that as well, what I would say is it doesn't hurt to actually also take a look at your muscle imbalances. So this way you're kind of doing two things at once. You're kind of paying attention to pacing yourself. And then at the same token, you're also starting to kind of uncover your muscle imbalances. So usually when I work with people and they tell me, hey, I've done this marathon or that marathon, I say, okay, well, what happened during that training? What other issues did you have? Did you have any flare-ups? And then I always look at, okay, now what are we also training for? Trying to see, were there some other things that you might start transitioning into your training now that could potentially lead you to that injury? And then if we also focus on some of the muscle imbalances and we look at all the things there and we pace ourselves, because just like with Eric, with the runners that work with me that come initially in pain, we're not running right away. Usually it's about 2 weeks hiatus. We're working on those muscle imbalances, really getting the body top shape. And then their first run out is no more than 3 miles, because I want to actually know what they notice at mile 1, 2, and 3. So this way we can kind of start gauging, how's that body feeling? What are they noticing? Because there is going to be some changes to that gait just naturally by working on those muscle imbalances.
And I can verify that too. Even as a veteran runner and coach, sometimes I get a little too aggressive in the beginning, and we have to pay attention to those early warning signs. And the encouraging thing we've all been addressing is you learn to identify those warning signs and know how to then, you're equipped with the tools to respond to them. You don't have to lose that much time in training. It might require a little backing off, but then you can get right back to it without a lot of time lost. The real problem is when you try to run through them, and shin splints generally don't let you run through them. They catch up eventually.
With vengeance.
Unfortunately, and or can become a stress fracture if they're really pushed to the extreme.
So 2 things I would ask. I actually had this with another runner of mine. We found out that when she walks, she's actually the angry walker. So when she walks, she actually heel strikes the ground more. And we found that when she ran slower, she was actually heel striking the ground more, versus when she ran faster, she was actually going more midfoot forefoot, which was a change in her running. So that's where I would ask you, do you know, like, if you're trying to like walk really fast, are you that angry walker where you know automatically when you slow your pace down, it's more of a walk run versus the actual run? And also too, are you, when you're running at the slower pace, is it a different type of surface? That would be my other question there. You know, are you doing slower pace runs on a treadmill because you're confined to the actual length of the treadmill, and when you're running outside you're just kind of like, okay, I have free space, I'm running differently? There is a difference there too. That's why I asked you guys to really identify what surface are you running on, and where are you running on, because that can impact this issue here. So ideally, I mean, I get it. Maybe you might not be in an area where you have access to trails. So like for me, I have more access to just kind of street, road, a little bit of trail, not too much, just because I'm going to run right from the home. So initially, what I always tell people is when we're starting to recover from this injury, start with just a nice flat surface, no treadmill, because the treadmill, you definitely, that could be one that just might aggravate a little bit more. Asphalt will be a little bit softer, have a little bit more shock absorption there. Definitely, if you have a track nearby, that would be a little bit better, because usually tracks have a little bit more cushion to them. If you are somebody who has trails, that's fine as well. The only thing is with trails, if you don't have great ankle mobility, the trail actually might make it feel worse, because you still haven't addressed those muscle imbalances when it comes to the musculature of the lower leg. That's why I would kind of say more track / asphalt, definitely not sidewalk, kind of more street, just because sidewalks could be tripped, cracked, angled, and again, could put a stress on the ankle in a way where you might just feel a little bit more irritation. But that would be my best recommendation, and try to stay with mostly flat surface, not something that's going to be severe incline, decline, because again, that might put a little bit more dorsiflexion into the ankle where you're not used to it just yet, because you haven't addressed those imbalances. So a lot of times treadmills are not serviced correctly. They're not calibrated. So you have to remember that if you are somebody who is running on a treadmill that's at a gym, not your home one, but actually at a gym, you have various different body types actually going on that treadmill. You have no idea the age, the mileage that has already been put on that treadmill, the last service date, things like that. Plus also too, if you're using a home treadmill, a lot of times the home treadmills are not that great in absorbing shock. You have to look at, well, was my home treadmill more designed for the person who is walking versus the person who's going to be doing like marathon running and be running, you know, so many miles per week on that treadmill? That does become a factor. I also have found if I was to have you run on a treadmill, and say even if it was a good commercial grade treadmill, but the actual length of the treadmill was almost shorter than your actual height, there's a high probability that you're not going to run at your correct stride, gait, speed, because you may feel like you actually are going to kind of fall off the treadmill, if not be kind of like going into the treadmill too much. You know, this is where sometimes running on a treadmill, if you are somebody who hikes up the knee a little bit more, has more, you know, back kick, things like that, the treadmill is going to put you in a confined space where you might not be able to feel like you can really have that stride, that pace, that everything that goes along with your gait that you normally would have if you're somebody who runs out on the road. But again, I get it. Some of us may have to be up at 4:30, 5 a.m. And especially in the winter, your treadmill might be your only device, but it is not the number one advice that I would go to. One, I would definitely get evaluated by a PT if you can in person, just because it could be definitely leading to more of a tendonitis issue, especially if you're noticing that popping sensation. Kind of would tell me there's some instability of the ankle. We might need to create some more stability to the ankle. So I would want to also know, again, what kind of surface you're running on, and also to what other things you're actually doing. That would kind of lead me to think there might be some more issues with the peroneals if it's on the outside of the ankle that you're hearing that popping, and looking at, again, your Achilles too. But I would have to know more information. So there's actually a great trick here. And I give this one, especially to anyone who suffers with knee or hip pain as well. Swimming. And I've created this, it's a kicking program. And I'm happy to give everybody access to that as well. But if you do the kicking program with flippers on, you actually will increase ankle strength really nicely, which again will help with eliminating this issue, because what you're doing is you're not necessarily putting strain on the lower leg. You are focusing a little bit more on hamstring, glute, and also quad, but allowing for the ankle to have a lot of strengthening done under resistance by doing a nice, easy flutter kick in the water. It does really help to have the fins on, because you really will do that very nicely there.
And then kind of piggyback along that, the runner we had him biking. He did have access to a pool, but he hated the water. So biking's fine. When people have shin splints, just to I tell them not to use straps, so they don't overly activate that muscle. So kind of more just pushing into it a little bit. The shin splints on the anterior side of the front, sometimes you pull up on that muscle a lot to get it up there. It's really not a big deal, but just to err on the side of caution, I just said no straps. You can probably get away with it. But he did well with biking. There wasn't any issues with that with the shin splint there, because there's not a lot of force going through there.
It's hard to get the same aerobic dynamic with biking. Usually runners have a really strong aerobic base, and unless you're biking up a hill for a long while, it is hard to get that, but at least it is still working the muscles more gently.
Please don't ignore the strengthening routine along with running, and as well as Heather was saying, flexibility, all that stuff goes into it. A lot of runners that I've seen don't like strengthening. They like flexibility, but just know that increasing the load capacity of your tissue is fantastic. Will be much more protective for you, not only with shin splints, but any injuries that may be present.
Usually about 2 weeks, as long as you're doing all the things, you're icing, you're truly resting, you're doing some soft tissue work to the area. If it truly is just shin splints, it should be about that 2-week period, but it could also take up to 4, depending upon how much damage is actually done to the tissue. If it doesn't seem to be resolving itself, that means the issue isn't at the shin, it's somewhere else. And that's why I said that gait analysis does become a real key in figuring out what else could be triggering that shin splint that's going on.